Hello friends. So in our previous classes we have discussed about the sphenoid bone body. So here you can see the individual sphenoid bone. The body you have discussed. So the review of the sphenoid body, it is having superior surface. Then here you can see the inferior surface, and this is anterior surface, and here is the posterior surface. So four surfaces you remember. Now it is posterior surface. Here you can see the superior surface and anterior surface, and then the inferior surface. Now we are going to discuss about the outstretched wings. As you see the bat, as it is having the wings outstretched, in the same way here also the two greater wings, they appears like the outstretched wings of bat. Now we are going to discuss about the wings of the sphenoid bone. So wings of sphenoid bone, it is having two different sets of wings are present. One is the greater wings, another one is the lesser wings. So maybe in this colored one I cannot show you the clear lesser wings, so I just took another skull to show you clearly the lesser wings of sphenoid bone here. Okay, also let me explain about the greater wings of sphenoid bone. So greater wings of sphenoid bone, it is having a superior surface. So superior surface, and the margins are, one is squamous margin and the posterior margin. Squamous margin where it is going to fuse with the squamous part of temporal bone, and the posterior margin it is going to relate with the petrous part of temporal bone, where we can identify a cartilage over here. So the cartilage is Spinopetrous synchondrosis. Spinopetrous synchondrosis. Now we are going to see the surfaces of the greater wing of sphenoid bone. So this surface is called as superior surface or cerebral surface of greater wing of sphenoid bone. Superior surface or cerebral surface of greater wing of sphenoid bone. So what is the structure present here? One, we can identify the temporal lobe which is present here. So the middle cranial fossa, the anterior boundary is formed by the superior surface of greater wings of sphenoid bone. Another one is it accommodates the floor. It accommodates the floor of temporal lobe of the brain. It accommodates the temporal lobe, floor of the temporal lobe of the brain. And also one other features what we can identify is a foramen which is projecting anteriorly. So in this individual bone, you can see somewhat clearly. Yes, you can identify a foramen which is extending anteriorly. That foramen is foramen rotundum, which is passing the maxillary division of trigeminal nerve. Then we are just moving posterolateral to this foramen rotundum. Here we have seen the foramen rotundum. Posterolateral to the foramen rotundum, we can identify an oval shaped foramen called as foramen ovale. Foramen ovale. Then behind the foramen ovale, we can identify another foramen, small foramen called as foramen spinosum. Foramen spinosum here. So in this skull, we can identify somewhat clearly. I will show you all the foramens. Yep. Here you can identify the foramen ovale. Posterior to this one, we can identify foramen spinosum. So sometimes you may identify another occasional foramen which is present medial to this foramen ovale. So if such foramen is present, the foramen name is emissary sphenoidal foramen. Emissary sphenoidal foramen or foramen of Vesalius, it passes the emissary vein. It has to present between foramen ovale laterally and foramen lacerum medially. And sometimes you may identify another foramen on the bridge between ovale and the spinosum. So if such foramina is present, that name is foramina innominatus. Foramen innominatus. So if such foramen is present, it is passing lesser petrosal nerve. Lesser petrosal nerve is passing through the foramina innominatus. So that is about the occasional foramen which is present medial to the ovale. That is about the superior surface of greater wings of sphenoid bone. Now we are going to see the lateral surface of the greater wings of sphenoid bone. So earlier we have seen the superior surface or cerebral surface of greater wing of sphenoid bone, and now we are going to see the lateral surface. So the lateral surface of greater wings of sphenoid bone, where it is present, and let me show you clearly somewhat. Yes. So here you can see it is a vertically convex in shape, and it is having a crest which is separating the lateral surface into two surfaces. So entire this surface is called as lateral surface. Okay, so this surface is called as lateral surface. So this lateral surface is further divides into two different areas by a crest. So here you can see a crest. So this crest is dividing the lateral surface into two surfaces. One is temporal surface here above, temporal surface, and below infratemporal surface. So the lateral surface is further divided into two parts by infratemporal crest. So in individual sphenoid bone you can identify somewhat clearly. So here we have the individual sphenoid bone. Yes, here you can see the right side of the sphenoid bone to show you clearly. Yes, here you can see the lateral surface of the greater wings of sphenoid bone. So this surface is called as temporal surface. Below that, this surface is called as infratemporal surface, and here you can identify the crest. So the lateral surface of the greater wings of sphenoid, the temporal surface, which gives origin to the temporalis muscle, whereas the infratemporal surface, which gives origin to the lateral pterygoid muscle, upper fibers of lateral pterygoid muscle fibers. That is about the lateral surface. Coming to the orbital surface. So orbital surface of greater wings of sphenoid bone. So orbital surface, it is, let me explain you clearly. You can see it is a quadrangular shape. Yes, you can identify clearly this is orbital surface of greater wing of sphenoid bone. It is quadrangular in shape. So superior laterally it is fusing with the orbital plate of frontal bone. This blue color one is orbital plate of frontal bone. And laterally it is going to articulates with the zygomatic bone. And medially, now let me show you the medial boundary. So medially it is forming the inferior margin or inferior boundary of superior orbital fissure, and inferiorly it is forming the superior boundary of inferior orbital fissure. So these are the four boundaries of it, and we can identify a tubercle over here at the medial margin, which gives attachment to conjoint tendon or common tendinous ring of Zinn, where the superior rectus, medial rectus, lateral rectus, inferior rectus, which arises that conjoint tendon, common tendinous ring of Zinn, which is attaching to the tubercle, which is present on the medial margin of the orbital surface of greater wing of sphenoid bone. Now the irregular margin, which is related to the apex of petrous part of temporal bone, where we can identify a cartilaginous plate called as petrosphenoid synchondrosis. So anterior to this foraminal acirum, we can identify a canal called as posterior part of the pterygoid canal. Now I will show you this posterior part of pterygoid canal in this individual bone. So here you can see the posterior part. Yes, here you can see the posterior part of pterygoid canal, which is the anterior boundary of foramen lacerum. That we can identify at the irregular margin of greater wing of sphenoid bone. Now we will see the lesser wings of sphenoid bone. So I already have discussed about the lesser wings of sphenoid bone earlier briefly, but now I will explain you somewhat clearly. So the lesser wings of sphenoid bone, which are projecting posteromedially, and these lesser wings are forming anterior clinoidal process, and from the body of the sphenoid bone, exactly behind the sulcus chiasmaticus, you may identify a bony projection called as middle clinoidal process, which is extending upwards. So the anterior and the middle clinoidal process, which are going to fuse with each other by the help of a ligament called as carotidoclinoid ligament. Then through that space, internal carotid artery, I am just showing you a thread in the form of an internal carotid artery, how it is passing through the carotidoclinoid ligament, carotidoclinoid foramen. Okay, so that is about the lesser wings of sphenoid. And anterior clinoidal process, it is going to fuse, not only fuse with the middle clinoidal process, sometimes the posterior clinoidal process is extending upwards, and anterior and the posterior, they connects with each other by the help of a ligament called as interclinoidal ligament. Interclinoidal ligament, sometimes it may get ossifies. In this part, you can identify clearly both carotidoclinoid ligament and the interclinoidal ligament got ossified. Let me show you clearly. Yeah, here you can see the interclinoidal ligament, ossified part of interclinoidal ligament. That is about the lesser wings of sphenoid bone. And lesser wings which are extending laterally, and they are forming the anterior boundary of middle cranial fossa. And the venous sinus which is present here, is, so at the posterior border of lesser wings of sphenoid bone, you can identify the spinoparatal sinus, and also these lesser wings are forming, they are contributing to form the posterior part of the roof of the orbit. Let me show you clearly. Yes, here we can identify orbital plate of frontal bone, and posterior part is contributed by the lesser wings of sphenoid bone. And the lesser wings of sphenoid bone, it is also contributing to form optic canal, so which is passing optic nerves. So on either side of the sulcus chiasmaticus, we can identify this optic canal. Then coming to the pterygoid process, the bat feet. So we have seen the bat wings, and we are going to see the bat feet. What are the resemblance? Which structures of the sphenoid bone resembles like the bat feet? So coming to this pterygoid process, yes, I'm just tilting it down and trying to show you from the inferior aspect. Yes. Here you can see the two plates which are the parts of pterygoid process. One is lateral pterygoid plate, another one is medial pterygoid plate. So if you want you to show clearly, you can see the two pterygoid plates, lateral pterygoid plate and the medial pterygoid plate. So the medial pterygoid plate, it is having a bony projection which is projecting downwards and laterally, called as pterygoid hamulus. And superior border of the medial pterygoid plate, you can identify the depression called as Sphenoid fossa. So if you want to show me clearly, I will show you in this uncolored one. So these are about the medial pterygoid plate and the lateral pterygoid plate. This is about the Sphenoid fossa, and the pterygoid hamulus I will show you. Yes, here you can see the pterygoid hamulus. From the medial pterygoid plate, we can identify the pterygoid hamulus, bony projection which is projecting downwards and laterally. It is holding the tensor valley palatine tendon. And between the medial pterygoid plate and the lateral pterygoid plate, we can identify the depression. So this depression is called as pterygoid fossa. And here we can see, first I will explain you the medial pterygoid plate, then I will go for lateral pterygoid plate. As I told you earlier, medial pterygoid plate is having pterygoid hamulus, and superior part which is extending upwards, and it is reaching to the upper part of the petrous part of temporal bone, and it is forming the medial boundary of sulcus tubae, where the cartilaginous part of eustachian tube is passing here. It is forming the medial boundary of the sulcus tubae. Here you can see sulcus tubae. Here you can identify. I'm just passing the probe over here. Yes, here also I'll show you clearly. So this is nothing but the sulcus tubae. So this sulcus tubae, medial boundary is formed by this. It is extending upwards. This medial pterygoid plate is related to the medial margin of the eustachian tube. Then comes the lateral pterygoid plate. Yes, here you can see very clearly how the pterygoid process is present. Lateral pterygoid plate is having medial surface and lateral surface. Lateral surface which is giving origin, lateral surface which is giving origin to so this lateral surface of lateral pterygoid plate which is giving origin to lower head of lateral pterygoid muscle fibers, lower head of lateral pterygoid muscle fibers. And the medial surface which gives origin to medial head surface of lateral pterygoid plate which is giving origin to medial pterygoid muscle. Blindly you can remember lateral surface of lateral pterygoid plate giving origin to the lateral pterygoid, medial surface of lateral pterygoid plate which is giving origin to medial pterygoid muscle fibers. That is about the pterygoid plates. Then coming to the pterygoid process, yes, here you can see a bony process which is projecting posteriorly. Can you find the bony process? Yep. Here you can see the bony process which is projecting back, and here this bony process is going to fuse with the spine of the sphenoid by the help of a ligament called as pterygospinous ligament. And not only to this ligament, the spine of the sphenoid is giving attachment to another two ligaments also which are attaching to the spine of the sphenoid. One is anterior ligament of malleus and the spinomandibular ligament. That is about the pterygoid plates. Thank you, friends.